Each year on June 19th, the world brings awareness to sickle cell disease. According to the CDC, about 100,000 Americans are affected by sickle cell. The majority of those patients are Black. Those who have the disease sometimes suffer in silence as many stigmas and misconceptions shape treatment. Our Brittany Moncrief visited the University of Tennessee Health Science Center, where nurses took part in a very special sickle cell boot camp.
That's right, Yvonne. This program is truly the first of its kind. And as many health professionals and sickle cell patients will tell you, it's needed. The disease makes red blood cells appear in a sickle shape, preventing oxygen from properly flowing through the body. ABC 24's own senior producer, Chris Ruffin, has been fighting sickle cell ever since he was a child. And he says the program not only gives hope, but stresses the importance of what sickle cell patients need most: someone to listen. Sometimes all you have to do,
can you not get my shoes?
Is listen.
I got you.
All right.
Chris Ruffin is our senior producer at ABC 24 Memphis and also a sickle cell survivor.
Diagnosed as a child, 28 years old, been dealing with sickle cell, and basically had a stroke when I was 6. And since then, everything's been fine. I've not had many hospital stays.
Until now. At the beginning of June, Chris found himself in pain.
My back started hurting and I couldn't walk.
A pain crisis, forcing Chris to get help.
First hospital, we checked in at like 2 o'clock in the morning. We stayed at that hospital for about 2 hours. They said it would be an 8-hour wait. The second hospital, we got some luck and the doctor gave us meds, but I still wasn't feeling my best. And the last hospital, we found some relief, and the nurses were just like, hey, you're a sickle cell patient. We need to get you to the back immediately. This is our protocol.
3 hospitals in a matter of hours.
They just weren't paying attention. That's really what it was.
The #1 issue many sickle cell patients face: being heard.
If you don't listen to sickle cell patients, like, their body can shut down at a moment's notice. And you don't want your not listening to be the cause of somebody's death, you know? So that's how severe it can get.
Severity is what the University of Tennessee Health Science Center wants to prevent. For the first time ever, they hosted a sickle cell boot camp for nurses.
We're going to be your nurses.
We are actually making sure that nurses across the nation have adequate education on how to treat patients with sickle cell disease.
Dr. Artangela Henry helps run the camp, walking nurses through various scenarios patients experience.
These individuals have so many complications, literally from head to toe. Anywhere their blood flows, they can have a sickle cell crisis. Some of the complications that they have include strokes, issues with their eyes that can lead to blindness, heart problems, liver problems, stomach problems, problems in their bones. We want nurses to understand that if they're in pain for a reason. We have to investigate as providers to figure out what that reason is.
Maggie Robertson is a nurse participating in the program.
It's really been eye-opening too. It's really shown a lot of where, as like healthcare, we're failing of the sickle cell and ways that we can improve. Hearing from the sickle cell patients and saying, this is what I want as a provider, or this is what I haven't gotten from providers. The biggest thing was to listen to them, to listen and understand.
You tell me if it's too much, okay?
A request so simple, yet often ignored.
That's where a lot of sickle cell patients get furious at, because sometimes nurses, sometimes doctors don't understand our pain. And with that, you kind of just, you can't do anything, because a lot of people think you're just trying to get drugs, you know, because it's a African-American disease, but it's also a bigger disease that affects Hispanics as well.
Making this sickle cell boot camp imperative.
It gives me a lot of hope, because for one, I just wrote a book on sickle cell, just trying to basically telling nurses, trying to get more people to be advocates. You have to speak up for people even if they can't speak up for themselves.
On top of the pain, this is for all those who are living with sickle cell disease, who have been pleading for people to just listen to them, just hear them.
Deep breath out.
When I hear the word listen, I hear the word love. And I think when you listen to somebody, you show them that you have compassion for them, you show them that you love them.
And you show you care. For listening saves lives. And Chris' book is titled Succeeding with Sickle Cell. He mentors sickle cell patients on how to succeed in their own lives living with the disease.
Brittany, thank you, and thank you, Chris, for sharing your story. Very important work happening right here in our backyard that can impact millions worldwide.